He counted me in very slowly because I was having a conversation. Yeah, good people at Carilion was the conversation. Do you know anything about Carilion?
I do, just a little bit.
Tell us about who you are and what you know about Carilion.
I'm Letitia Furrow. I'm a physical therapist with Carilion Outpatient Rehabilitation right there across the street from the hospital. Been there for about 10 years now. More recently have been involved with treatments to help individuals with Parkinson's disease. So we've had a focus there. We have 2 therapists that are certified to do this treatment, Amy Metter and then myself, and actually it's 3 of us, and Joe Chalday. So we're all trained to do this specific treatment that I'm hope to share with you this morning and show you.
Show me how you going to exercise?
I have some people that came with me to help me to show everybody. We're going to do it together.
Oh, I thought this was the old folks. They're going to do it. All right. Ah, that's wonderful. You know, I'm old too, so I'm allowed to tease them. But in any event, it is a serious problem. It is something that you have to move with and keep to try to get going. And I will tell you folks that we recently, you know, Dee has been having a problem for a number of months, and the folks at that location were there for her, and we went through everything from, well, the whole water, out of the water, on the floor, on this, doing that, and everybody works so hard on behalf of the patients. It's a neat thing because you become kind of friendly. You become, do you know your patients, if you want to call them that? They're your friends by the time you finish?
We do. I'm biased, obviously, but I think we have a great team, and in our small community, we get to know our patients very well, and we do become attached to most of them, if not all of them.
But it works better, I think. Having a job in this community for a lot of years, and I liked my customers.
Yes, sir.
And your customers, they enjoy doing what they do, and like if you're serious and your intent is straightforward and you get with them and you're doing for them. Thank you for that.
Yes,
and
sir.
It gives me a chance to publicly thank people that tried to help Dee. So we are now on our way, as I mentioned when you sat down, to it's going to be involving a lot of surgery, but that'll happen between now and the end of the year. So that's good. All right. I'm looking. I have a cheat sheet here that's kind of neat. So talk about what we're going to be observing, and then what it is and what the symptoms are, and how you do this treatment.
Okay.
Is that appropriate treatment?
Yes, sir.
Okay.
Yes.
Go ahead.
This, what we do, it's called LSVT-BIG. It's a treatment for Parkinson's disease. And if you don't know, Parkinson's disease is a progressive disorder of the nervous system that affects movement. It typically affects middle-aged to elderly individuals. I have seen folks as young as 40 years old with this diagnosis. But it's associated with a degeneration of the basal ganglia, which is an area in the brain that produces the neurotransmitter dopamine, which is the chemical that's utilized to help us move. Common symptoms of Parkinson's disease include tremor, and that's typically one of the first signs that individuals or patients with Parkinson's notice. Also stiffness or rigidity in their movements. And slowed or imprecise movements. It's decreased control of their movements. And typically you'll see folks that they have shuffling steps, limited arm swing when they're moving, little or no facial expression, and then some will have soft or slurred speech. So
Wow.
it affects your limb system or your arms and legs in addition to your voice. And typically those symptoms worsen as the condition progresses over time. Obviously, everybody is different, but thankfully, there's different treatment approaches that can be used to help Parkinson's. Medicine is a significant contributor to minimizing the symptoms. Typically, most folks with Parkinson's are on a carbidopa-levodopa combination medicine, also known as Sinemet. There's also a neurosurgical approach where neurosurgeons insert a deep brain stimulator into the brain, and then voice and body exercise, and that's what I wanted to share, what I want to focus on today. Evidence-based research has shown how important exercise is for folks with Parkinson's. It's, in my opinion, it's medicine. Exercise is medicine, and I encourage all of my patients, you need to exercise just like you're committed to taking your medicines every morning.
That's always good, though, exercise.
Yes,
this
sir.
Is,
yes.
Would you classify this as a specialized exercise regimen, or, in other words, push-ups and chinning yourself on a bar, and running? There's exercise, but this is more, by listening to you, I would suggest more specialized.
Yes, sir.
Okay.
There's a group of 7 exercises that we do with every person that comes in for this particular program. These exercises have been shown to improve function, increase step length, increase trunk rotation, and ultimately overall function is what we're after. And I hope that we'll get to demonstrate some of those exercises in just a few minutes. But
wait a minute, time out. I mean, these guys are going to come over here and demonstrate?
We're going to all do it together.
I wonder if they got their business card from the entertainment kind.
You'll have to ask them.
No, I know them, and I'm not teasing them. I'm not making light of it. They know that. So do I. I have to smile, because no matter what it is in life that you face, you smile, and it ain't good sometimes, but you still smile. And people tell me that, he's crazy, but that's LSVT. What LSVT Loud? Lee Silverman voice treatment.
Lee Silverman voice training. And
what is a Lee Silverman?
It's the person that this treatment was named after.
All right.
Yes, sir. And it initially started for the speech, to help individuals with their speech. This Lee Silverman was a lady, and her daughter or granddaughter was the one that helped to start this program, and they had difficulty understanding grandma when she talked and that type thing. So that was the motivator behind this program. And then the LSVT Big is what physical therapists do. LSVT Loud is speech therapists perform, which we can also do at our clinic. But the LSVT Big was based on the same principles of the Loud program, and it focuses on the limb system. And again, this research has indicated that this program improves brain function and may slow the disease progression. But it focuses on the amplitude of movement. As I said before, these patients are shuffling steps, smaller movements, softer voice. So when we're working together, are encouraging the biggest range of motion that the person has, with the highest level of effort every time we do these exercises and in everything that they do. This is a very task-specific program.
Varies from patient to patient?
It is. It's very patient-specific. A patient, on the first day I ask them, what are you having difficulty doing? Putting shoes and socks on, getting in and out of bed, making the transition from sit to stand. So everybody has certain things that they're more challenged with.
Now that means this does not affect everybody. If you get measles, it affects everybody pretty much the same way.
Right.
This is very individually oriented. So that puts the folks that are doing this or leading this, as yourself and the therapists and the rest of the people down there, which I will tell you is a good bunch of people. But
Thank you.
Yes, I'm partial. But in any event, you all have to do a lot of different things. Because everybody is, okay.
Yes, sir.
Treatments for Parkinson's. All right.
It's a very intense program.
Yes.
most people come to physical therapy 2 or 3 times a week. With this program, they're coming 4 consecutive days of the week for 4 weeks, so a total of 16 visits. They have one-on-one interaction with the therapist, and they're with us for an hour each day. So that's much more intense than...
They still like you after that?
Most of them do. Depends on the day, I think. But like I said, it's very intense. We have high expectations when they're in the clinic with us, but then we have expectations that the patient's going to do homework. We give them daily homework pertaining to their treatment, and again, that's task or patient specific.
All right. We have with us 2 people that are going to demonstrate. Will you tell us who they are?
Yes, sir. It's Richard LaBarber and John Nieberlein. And I'll let you question them about how they feel about the program.
Oh, I know that, especially Richard, because I've talked to him a lot, and I know he's looking forward to coming down here and talking about it. Right? Right. Oh, look at that. Okay. To share this, to put emphasis on this, now I have nothing to do with medicine. I mean, by that I mean I take it if I need it, but I'm saying I don't know about it. But I do know, as my mother used to tell me, it's good for you. Which meant it tasted bad, or it was going to hurt me to do it or something, but it's good for you. And this is very, very interesting and very amazing because I personally have a connection with what has happened there, so I'm thrilled to have you in to do this, and very thankful for the folks that are here to take a big step forward and demonstrate for the world. But it's neat. Thank you, guys. Appreciate that. We'll meet them in just a minute. But LSVT, tell us again.
Lee Silverman Voice Training.
Okay.
That was the initial program, and then they've added on the BIG to incorporate the movements that we do in physical therapy.
So we're dealing with the speaking and the actual physical exercise.
Right.
Okay.
The loud program is provided by a speech therapist, and then the big portion is provided by a physical therapist.
Okay.
So.
You like this work?
I love it. Yes, sir. I'm very passionate about this program.
Oh, I hadn't noticed that. I thought you were just being calm. No, it's good, but it shows when you and the folks do it that you are behind what you're doing. You're not, ladies and gentlemen, this is not like, hey, when you get a chance, come on in. Yeah, do that, do that, do that. No, this is people with heart, people that are very serious and work very diligently to do something that will help folks. So that's terrific. I'm very happy to have this opportunity.
Thank you
for
having us.
Anything else you want to say before we take a break and get our 2 demonstrators?
Just with this program, and as a therapist, I feel like it's my responsibility to push our patients, no matter what they're coming to us for.
Oh, I'm sure they always love that.
This is I love this program so much because I like to see significant change, and it's a huge difference from seeing the person on the very first day compared to when we finish on that 16th visit. I feel like, obviously, I feel exercise is medicine, but I feel like I'm the patient's dopamine. It's my responsibility to push the patient, to reinforce these exercises, to motivate them, and to empower the patient with the potential that they have to stay active.
Since you are such a calm, quiet, genteel person, does a patient ever get a little bit get off my back kind of feeling?
I'm sure they do.
No, I'm
yes,
sure
sir.
they do. Okay. But then you go back to what Mama said. It's for your own good.
That's right.
All right.
That's right.
What
Yes,
am I
sir.
talking- And no, I'm not making fun, folks, and I'm not teasing, but I've been there and I have seen in the family. So I am thrilled that this is being brought out, demonstrated, and told, because it's necessary that you know, and if necessary, then you better do it, you know? And good people, good people. I am so pleased with that. Okay, now, what we are going to do, I guess, have you finished talking?
I just wanted to share with folks that if they want this particular treatment or feel like they're a candidate for it, we do need a prescription from their doctor, which can be from their primary care physician and or a neurologist.
Okay.
Most folks with Parkinson's end up seeing a neurologist. So
All right, I'm going to interrupt you now because I want you to bring that out at the end. We'll
Okay.
we'll do our demonstration and
Okay.
exercises and whatever, but then as we conclude, you can go ahead and remind everybody. Okay?
Sure, I can
That's
do
what I
that.
like about you. Not pushy, very quiet, easygoing, right?
most of the time. Try to be.
All right. I'm sorry. No, I'm not, but that's okay. Thank you.
Yes, sir.
All right.
Thanks for having us.
Great, great, great stuff. What I'm going to suggest is that we take a commercial break, and then you can get us set up. And then as we come back, maybe you can tell us exactly what we're doing.
Okay.
And then we'll have demonstrations as well.
Okay.
Okay?
All right. Sounds
All right,
great.
guys? Great. Good. All right. Ladies and gentlemen, I guess you can tell that I am intrigued, I am pleased, and very thankful. And without even thinking about it, I was blowing the horn of Carillion this morning a couple of times. So this is good. If you want to get better. And of course, we all do. So we're going to have a commercial break now. Please pay attention to our sponsors. And this remains Dick Shoemaker at Rise and Shine. And I'm going to have a couple gentlemen here that are going to rise and shine for us. Think about it. After these words from our sponsors, we'll be right back.
Okay, I have with me Dr. Richard LaBarber and John Nieberline, and we are going to demonstrate some of the exercises that we do as part of this LSVT Big program. So we'll just go through about 3 repetitions of a few of these exercises. So first we have the patient sit up nice and tall, shoulders up, feet shoulder width apart, and we're reaching forward, down to the floor, up really big as you can, and then back to stretch across the front of the chest, and then finish nice and big. We're going to go through that again. Out, down, up, back, and finish. We start with these just to get good and stretched out, warmed up, and back. Good. So we do 2 different exercises seated, so we're going to skip over the second one and progress on to the standing exercises. So if you'll stand up. And the first one we're going to do is take a big step forward with your right foot first. Ready? So forward and back. Forward. And with these exercises, we are encouraging as big of movement as we can, as the patient can, to train them to move outside of their box. What feels good for them? I want them to go beyond that. Okay? And then we're going to do the one where we step to the side. So let's step with your right foot first. Just don't trip over your cane there. So we'll go to your right. Ready? Side and back. Side, straight. Good, very good. And then another one of the exercises works with the arms and legs to simulate the pattern that folks use when they are walking. So we'll do that one where you put one foot in front, And we're just going to rock forward and backwards a few times just to get into the swing of things. Forward. There you go. Good. And then we'll incorporate our arms. So lifting the arms up as high as you can. Good. Obviously, we don't walk like this when we're out in public, but the bigger we practice moving, the more normal that movement becomes when we're in the real world setting, when we're at the grocery store, going to church, going out to eat. So, good. Okay, we'll stop that one. Let's do one more where we reach across our body, and this time we'll reach over to your left. So we're going to start like this and reach with your right arm across. So come across and then straight. Good. Reach across and back to the start. Good. Out, together, and out, and together. That movement really works on trunk rotation. A lot of folks with Parkinson's have difficulty rolling in bed, turning to get in and out of their car. So by doing that exercise, it helps to loosen up your trunk muscles and gives you more flexibility to turn to each side to help those movements to be a little bit easier. There's a total of 7 exercises that we work on in the clinic. These in addition to a few more, but that's enough to give everybody the feel of what we do and how active we really are during that 60-minute time frame that folks are in the clinic with us. Thank you.
Tisha, can I say something?